So now we're going to do a case study. We have a 50-year-old male patient, status post endo AAA repair, measuring 8 centimeters in diameter. He's admitted to the ICU with a suspected graft infection. The patient weighs 150 kilos, and his chart states the staff had difficulty with obtaining vascular access in his previous visit. The doctor has ordered 2.25 grams of vancomycin IV twice a day for 1 week. No IV is currently in place. So what is your first intervention to obtain vascular access?
Assess the patient's vasculature, previous,
Right, and so in the chart, it mentioned that they had difficulty in this last visit obtaining vascular access.
Maybe ask where was the last time he had vascular access? Is there a place that he knows is not good?
Sure. What do you know about vancomycin and its pH?
very low.
Is it less than 5? It is. So if we're going to have vancomycin twice a day for a week with a pH less than 5, what would we really want? PICC Line or Central Line? Good. So call the doctor and using SBAR communication, request an order for a PICC line. Because by using that SBAR, we're able to give them a background as to what is going on with that patient historically. They had difficulty with the vascular access. Okay. So the doctor submits an order for a PICC line, and the PICC nurse is called. Approximately an hour later, the PICC nurse arrives and places a triple lumen PICC in the patient's right arm with the insertion point distal to the antecubital space. She also starts a 20-gauge peripheral IV in the patient's right forearm using ultrasound guidance in the cephalic vein. An order for a chest X-ray is submitted. So show me where the peripheral IV was placed. I think I saw you do it first. All right. Can you start using the PICC line?
No.
You don't want to use chocolate.
Oh, I don't either.
You don't want to eat it? No problem. What is the purpose of the chest X-ray? To verify that tip placement prior to use. Good. Okay, so now you're waiting to hear the results of the chest X-ray. You check the EHR to see if the report has been submitted. You access the report, which reads, right-sided peripherally inserted central catheter with the tip terminating in the distal superior vena cava. Can you start using the PICC line? No. How come? You need the doctor, the radiologist, to verify that tip placement. You actually need to hear it from them, okay? So, but you know it's in the right position, correct? You just need to get that clearance from the radiologist. That's his job to read it, right? So, with that being said, what else do you need before you can start using the PICC line? A phone call from the radiologist or to the radiologist to ask if you can start using it. Or for them to call and say, it's very rare that you're going to see the report before you ever get a phone call, right? That doesn't happen very often. All right, so 3 days later, you were assigned to the same patient. His vancomycin has been administered on schedule, and his peaks and troughs are within normal range. You go to hang his morning dose. What do you do prior to starting this dose of vancomycin? Check his chart? Oh, his trough. I said they're normal.
Okay.
So you assess the function of? Correct. Just the one port that you're going to hang? All of them. Right. So each lumen should easily aspirate and flush. So what supplies will you need for that? Single syringe, just empty or normal saline, right? Okay, what else? Alcohol. Yeah, those little Puros caps. Okay, good. All right, 2 hours later, when the vancomycin infusion is completed, you go into the patient's room to complete the administration and perform an insertion site assessment. He is laying comfortably in bed with his head of bed at 30 degrees. You remove the IV tubing from the PICC line and flush the lumens. The lumen that had the vancomycin aspirates and flushes well. The other two lumens are sluggish. So they were functioning before, and now they're sluggish. So list the supplies needed for the PICC line after medication administration.
The flushing. So you may have to need alcohol.
You want some more candy?
Yeah.
So what interventions can you perform to further assess function of the lumens?
Okay.
What's one thing you want to do? The first thing you want to do, probably.
So you try to flush them.
Yeah.
And then.
So repeat trying to flush them and aspirate them. So what else can we do? Let's say that doesn't work. What can we do next?
And have reposition your patient or have a cough.
Yes. So reposition the patient, have them sit up, perhaps a high Fowler's position. And yes, definitely turn the head to the opposite direction and cough. Why is that? What is that going to do?
It helps them open up their chest.
Helps them open up their chest. But the movement of the cough and also sitting up, the tip of that PICC line may actually be up against the wall of the SVC. So by doing that, you may cause it to actually just kind of float away from the edge, and then you're not going to have a problem. Okay, shouldn't have a problem. All right. After implementing other troubleshooting strategies without success, you notice the area above the patient's right antecubital space is slightly swollen. You look at the rest of his right arm and compare it to his left. And I've got a little picture there. So what do you think is going on here? Possibly an infiltration. So we couple that with sluggish. We weren't able to fix anything with all the troubleshooting strategies that we did. Could be a clot. Exactly. Okay. So what do you do next?
Something in the future.
Right? Don't use it. Don't use it any further than what?
Call the doctor.
Call the doctor. Good. So further investigation is going to be needed. May result in a declot, an exchange, or removal and reinserting on the contralateral side. Why would we want to do the contralateral side? Yeah, I'm not going to put it in the same place if we have a clot that's going on. All right. Very good. Do you have any questions?